and the prisons are overcrowded. They're tier 1 priority. They're supposed to be. And because you can't do social distancing in prison, as everybody knows. So we have seen everywhere else that I've heard of, prisons getting like the whole facility tested the way they're doing at Felmers Chaney and Marshall Sheriff. They come back with like 80% of people testing positive. So the rates of positive tests in the prison system is probably going to jump dramatically. One interesting thing that we've noticed on that statistic is that the rate of positive test results statewide has gone down a little bit compared to last week, whereas the rate of positive tests in the prison system has gone up. And like I was just saying, it's likely to jump like more than triple. There are around 120 people in those two facilities together. And so if 80% of them are positive, that's 100 more positive tests. So that's what we're probably expecting to see come out later this week. We also know anecdotally that people who request tests, including people who have symptoms, are being routinely denied, especially at Columbia Correctional and Waupun Correctional, where there have been exposures, but far fewer tests than other facilities that have not reported any exposure. To try and quantify this problem, we have created a new thing, which is a hotline that incarcerated people can call into. The number for that is 414-207-9691, and Ty's got it up on the screen here. We've got a couple of people who are helping do that. Ty set up a special number that rings multiple phones at once. So, and then we've got a couple volunteers who are helping out with that. So I want to give thanks to everybody involved in that. And if you would like to also volunteer and help out with handling that line, send Ty a chat message on the app right now, or an email at the number on the screen. I'm going to read it again for people who don't have video. It's 414-207-9691. So that's the number to give to your incarcerated loved ones if they or someone that they see and know has symptoms and is not getting tested. There's a whole questionnaire that we've made up to kind of gather that information and then try to take action on it. Then the next thing that I want to talk about is I did a public records request on recent deaths in the DOC just to kind of check on them. And I got a response within a few hours, which is really unusual. There were 2 anticipated deaths at Oshkosh Correctional in March and 3 unanticipated deaths at Red Granite, Oshkosh, and New Lisbon in April. The DOC distinguishes between anticipated and unanticipated deaths. So anticipated deaths are people who have a terminal illness and are expected to die within 6 months. Unanticipated deaths are people who die of various other causes. And so we don't know if any of these people have been tested or if they had any symptoms or anything like that. We can't find out that kind of information because of health privacy laws. The legislature might be able to inquire and get that, so we're going to have to follow up with them on that. But we can compare these numbers with historical data. We've done records requests in the past, and we found there were 3 unanticipated deaths in April is unusually high. Since 2007, there's an average of about 1 death per month. So 3 in 1 month looks like a lot. And there were also 3 in February and 5 in January. I don't have month-by-month breakdowns on any of this stuff from previous years. So 3 at this time of year might not actually be unusual. My understanding that people are much more likely to die in the wintertime, and so early spring, April, that might be not unusual to have 3 unanticipated deaths in 1 month. If anybody would like to volunteer, and I'm not a numbers person, I don't know how to go through this stuff. It takes a long time for me to try to just do stuff that like somebody who has more math skills or or statistics or anything like that, would be able to do. So if anybody wants to help out in any of those ways, please contact me. My number and email address is all over the place. And I would love to get some help actually going through and doing some friends and stuff like that with this information. One last bit of news before we get to the featured speakers part of this is that there was a disturbance at Red Granite. And we're going to talk about the COVID lockdown at Columbia, but I first wanted to share this news that kind of frames that story. On Monday, Red Granite Correctional went on lockdown because a guard tested positive. One unit resisted the lockdown, and the security team from Oshkosh was sent in to quash that rebellion. The Division of Adult Institutions says that it ended through negotiation and without any injuries, and we're hoping that we can verify that once we get more information from sources and such. This is an excerpt from a message that someone sent out as the situation was escalating. Oh, got it up on the screen. Do you want to read it?
Nope.
So he said, so they finally got us. A few people tested positive for COVID-19 and they placed us on a complete lockdown. No phones, no day rooms, no recreation, nothing. Nobody is locking in. The officers don't know what to do because nobody is listening to them and they're threatening a revolt. Dudes are on the phone. No one is going to work. Sergeants are losing control. I've never seen anything as uncontrolled as this. It can only get more volatile as minutes tick by. Fortunately, it sounds like it did not get more volatile and things went back on normal and nobody was injured, at least as far as we know at this point. But I just want to talk about how this kind of drives home that, like, on the surface, a lockdown seems like a reasonable response to COVID exposure. You limit movement, you limit further spread. But lockdowns in the prison system are also a form of collective punishment. And as you'll see from Zamani's statement coming up, the harmful aspects of these lockdowns can negate any positive mitigating benefits. So the most reasonable response to COVID-19 in prisons remains what we've been saying from the start, to reduce the population before exposure so that there is enough space to make real mitigation possible. Before we go to the featured speakers, I just want to see whether or not anybody has any questions. Has there been any chats or anything people asking anything? Okay. So
can I say a minute?
Sure.
On the whole business, I think it's really important that if you have a loved one and spread the message that to sign the HIPAA forms for us, I can give you both our emails. That would give us a chance. If anybody gets sick and can't send it after, it's also difficult. The HSUs don't like to hand them out. That way we can get information about you. If you get COVID, if you aren't tested and something bad happens, sign those HIPAA forms. I can send them to you, send you our forms so you can get them from the HSU.
Yeah, and we've sent that out over email as well. So anybody who's incarcerated, also if your loved one is incarcerated, they can sign one of these disclaimers for you to be able to access health information if anything happens to them. So that form exists. You can get it by contacting PEG, and it's a way that it's another way we can, not be left in the dark the way that we are about the deaths that have occurred. Okay. So our next featured speaker, or our first featured speaker, is going to be Damani Nantambu. He is a radical new African prison rebel and an organizer. He's frequently gone on hunger strikes and blown the whistle on different things within the system. He's been a great source to us for a long time. He was able to call us and pre-record this statement that we're going to play now.
Can you hear it?
No.
It's not playing it.
All right, spoken statement for phone conference. Intro. My name is Damani Nantambu. I'm 53 years old. I'm from Washington, D.C. I'm a federal prisoner serving life without parole for drugs, crack cocaine. called the ADX in Florence, Colorado. I came here in the DOC in 2012 and soon discovered this prison system is the most racist prison system I've ever been in. I've done time in the Deep South, Alabama, and Georgia. All right, the 10 years Sue Novak. Number one, under this warden, this prison has become so oppressive it is hard to breathe. For example, she took the tactic of bringing in trainee officers from the academy to toss up and trash our cells once a year, to bringing in outside staff to do it 3 to 4 times per year. This abuse of power tactic can result in losing hundreds of dollars in property they are too poorly trained to know they are not supposed to take, or thousands of dollars in property, which is the case in my situation, and the mass shakedown on 5/6/20 due to the escape of 2 racist prisoners recently. Number 2, also under Sue Novak, we have been locked down 12 months out of the 18 months she's been the warden at CCI for a variety of petty reasons resulting in collective punishment. A classic example. This has increased the level of despair and worsened the depression of those suffering from, such as myself. Also, there were a spate of totally preventable deaths under her, 3 in around a month. I knew each one of these inmates. These deaths and the response to them by staff exposed the incompetence not only of the correctional staff, but medical staff as well, especially in the case of Keith Gary and Larry Bracey. Number 4, in addition, Sue Novak came here and immediately cut our recreation time in half, from an hour and 15 minutes to 45 minutes per day. We already get the least amount of rec compared to all maximum security prisons in the DOC. The COVID-19 lockdown. Number 1, we have been on extreme lockdown since March 16th, 2020. This has caused the inmates to threaten to kill each other from cell to cell, called selling death. 2, cellmates are battering each other regularly.
Okay. We're going to pause for just a moment. It sounds like one person at least can't hear the audio. Anyone that is able to unmute themselves or like wave on the screen, if you are having a problem with your audio, if you could let us know at this time. Otherwise, we will troubleshoot the one person. I don't see any other movement. So Jody, I'm going to work with you outside.
Looks like Ron was putting his ear.
Okay, I can try to turn it up. Does the sound need to go up? If you want the sound up, give us a thumbs up. Alrighty, can do, no problem. We'll try it super loud. There's just some very difficult feedback and other ambient noise issues. So, let's see, we're just a few minutes in. I'm going to take it back just a little bit, 30 seconds here, so that we can so that these people can kind of hear this and get in tune.
Such as myself. Also, there were a spate of totally preventable deaths under her, 3 in around a month. I knew each one of these inmates. These deaths and the response to them by staff exposed the incompetence not only of the correctional staff, but medical staff as well, especially in the case of Keith Gary and Larry Bracey. Number 4, in addition, Sue Novak came here and immediately cut our recreation time in half, from an hour and 15 minutes to 45 minutes per day. We already get the least amount of rec compared to all maximum security prisons in the DOC. The COVID-19 lockdown. Number 1, we have been on extreme lockdown since March 16th, 2020. This has caused the inmates to threaten to kill each other from cell to cell, called selling death. 2, cellmates are battering each other regularly. On 5/6/20 at 7:05 a.m., I saw 2 officers in a white shirt walking an injured inmate from Unit 405 to the hole, because these inmates have reached their breaking point due to the lockdown. Number 3, we have consistently faced gross delays of medical care. A prisoner here lost his leg, Mr. Comey, because Sue Novak's directed that no inmate be seen for medical reasons during her lockdowns. During the COVID lockdown, I have been waiting for 18 months for pain injections in my back, and I'm experiencing excruciating pain. On top of this, my doctor told me she suspects that I have a cancerous mass in my toe bed and that I need the toenail removed. I have been promised this since December of last year, but it still hasn't happened. We've been eating non-nutritional bag meals for months and months on end, exacerbating my pre-existing health issues. Number 5, inmates/prisoners are only receiving 2 showers per week. Number 6, we have not been getting our personal clothes washed once a week per policy due to the lockdown. Number 7, officers are not wearing masks or gloves when they serve our meal, food, or medication every day. Number 8, not being able to receive visits or use the phone regularly. They are only releasing emails between 12 a.m. to 6 a.m. when most of us are asleep. Number 9, I don't know anyone who has received a COVID-19 test, and I have had symptoms for 7.5 weeks. Cough and diarrhea, a symptom 11 other inmates in quarantine had a few months ago. Number 10, during this pandemic, the powers that be in their infinite wisdom thought it was a good idea to bring in 150 to 300 outside officers over a week and a half and supervisors to search 9 of the 10 housing units at CCI, exposing us to the virus, making it more likely we will be infected. No, none of the 2 pair of stolen eyeglasses, bags of life-sustaining medication. Kettle Rain officers forced me to mail out 5 boxes of legal work. They also took 3 disposable masks, and the ones they made here at CCI are so poorly made, they don't provide any protection from the virus at all. They could have waited until the pandemic was over to do this heavy-handed collective punishment ploy. Number 11, 5/13/20, at 11:23 a.m., I witnessed Lieutenant Gary, spelled G-E-R-R-Y, and a rookie CO I don't know. 90% of the officers here are rookies, and 98% of the nurses also, which is a big problem. This is parentheses. Go in Unit 5 and pull out 11 mattresses. This is the unit where I saw nurses and officers go in donning spacesuits with bubbles over their heads. Surveillance tracing for CCI staff only. Over a month ago, a high-ranking official told me they had a video tracing mechanism to identify all the staff infected officers came in contact with. No such practice exists for notifying inmates who came in contact with staff or officers, or no COVID-19 tests either. This is dangerous, unfair, and shows how little they value our lives and our safety. A non-existent PSU department. PSU means psychology department. Number 1, I suffer from PTSD, OCD, and bipolar 2, and have been trying to see a psychiatrist for 4 to 5 months to have my 3 psychotropic meds adjusted all to no avail. Number 2, I have also sent the psychology department the green slip, is what they call it, put this in parentheses. On 3 months ago, no one ever came to speak with me, even though I told them I was suicidal and homicidal. Number 3, the one time I seen them come was a female doc. Came to see a neighbor in cell 30. And when she came on the test, she said, "Do you have any idea why you want to harm yourself in front of 19 other inmates? This gross mistake makes others reluctant to come forward and seek help for depression." 4.
Okay, just in case there are other people who aren't able to hear the audio, we are playing an audio file. If you cannot hear it, we will have, there will be a chance for you to speak up later, and I can gather those names of those people and send information, send links of the audio files to you via email. Okay, All right, we've just got a little over a minute to go. So anyone who's just hearing basically nothing here, one more minute of that, and we'll be back in gear for a moment. So bear with us.
Now, once a day, he punches his locker with his fist so loud it sounds like a gunshot. I've been shot before. Thus, when he does this, he triggers my sympathy for PTSD. Number section, the racist new unit manager. Our unit manager from another prison. Name is Miss McMartha. She is an in-your-face racist. Every inmate who challenged her lives, she is responsible for units 1 through 4. She sent my friend Oscar to the hole today. That was yesterday. Because the KM officers took 10 boxes of his legal work. She took inmate May's job last week and threatened to send me to the hole on 5/6/20 for trying to tell her my property was in the trash. Thank you for your time on these matters of great importance. To 980 prisoners at CCI, respectfully submitted. Damani and Tampa, May 13, 2020.
All right. So I'm going to unmute Stephen, who is a friend of Damani, who's been organizing with him. Stephen, can you speak and introduce yourself?
Hi, my name is Steven. My pronouns are he, his, and I live in New Jersey, but I have been in contact with Damani for maybe the past 6 months or so, and have kind of seen firsthand how egregious and awful Columbia Correctional is in so many ways. And kind of just speaking with Damani in the last few days here, just a few things that he wants me to highlight. I know he kind of hit on them on his audio recording, but he's been suffering from medical neglect for a pretty long time, and just getting him medical care honestly takes multiple calls, and and still not able to get all the medical care he needs. So it's really tough, especially kind of in the face of COVID, which is another kind of stressor. And as he also alluded to in the call, in early May, he and other prisoners at Columbia were subject to and brutalized by outside COs, or maybe COs there. I honestly forget that detail. And Damani, and I'm sure many others, had lots and lots of property destroyed. Like, Damani sent me a list, and he lost like 2 pairs of prescription eyeglasses and a lot of clothing and a lot of legal records, and he threw away all of like his newspapers and stuff. And I don't know, like, obviously a lot of people on this call are definitely familiar with that kind of torture, but it's definitely hard to hear, and it definitely makes our friends, family, and loved ones inside kind of their experience even the more precarious and the more torturous. So those are just a few things I wanted to highlight. Yeah.
All right. So we're going to open up for questions after our next featured speaker, which is William Ledford. Bill was put in the hole when we were trying to set up to have him call and pre-record a statement like that. I got an email from him. He got back out, and I tried to follow up with him and encourage him to call and record something, and he was not. Wasn't able to. I didn't hear from him, so we don't know what's going on with him currently right now. We know he was basically put about a guard who was retaliating. So the guard was retaliating against him. But we do have a previous call that I recorded with him, and I've edited it down to just 5 minutes of him talking about a situation that happened. But first, I was going to ask Ty to read this email that we got from him about some issues at Columbia, and then the call is about that.
Okay, so William Ledford, number 80495, you can see that on your screen. This email was received on April 12th, 2020 at 5:43 a.m. That indicates that the email was sent the day before, April 11th, 2020. The subject is exposure issues. Yesterday morning at AM Medical Pass, the nurse is wearing a surgical mask. Her name is Jean, which she never has done before. When I ask her why, she says, because she had been exposed to someone who had tested positive to COVID-19. When I asked her, somewhat stunned, why she was here and not self-quarantining, she quickly responds, well, I don't have any symptoms, and then hurries off. And I'm left thinking, just because you don't currently have symptoms doesn't mean you aren't contagious. And the CDC and President's Task Force every day are on TV stating if you have been exposed to someone who has tested positive, you should self-isolate/quarantine. And here she is passing out medication on the one unit and one wing that has the most at-risk and vulnerable prisoners in the whole DOC. To exacerbate the matter, later that day, 4/10/2020, I was called to get my lower legs wrapped in 4-layer bandaging. And the same nurse, Jean, this time without even a mask, is the one assigned to the bandaging. Really? It doesn't end there. Just earlier this evening, 4/11/2020, Sergeant Cascadin comes onto the wing. She has a mask on as well, when she never has before. She too admits that she had been exposed to someone who had COVID-19. When I asked her why the hell she wasn't self-quarantining, she replied that she couldn't, that the DOC had ordered that they come into work unless they were showing symptoms. The implication being that if they didn't come into work, that they would have been fired or disciplined.
So yeah, when we got that email last month, we immediately sent out a press release, sent out letters to emails to the Division of Adult Institutions and facilities to try to find out what's going on. I called Magda Tessemayer. She actually answered the phone, which is kind of unusual these days. And she said that they are doing fine as far as medical staffing goes, that they are complying with DHS guidelines, etc. I looked up the DHS guidelines, which clearly state that if you are exposed to COVID-19 as a medical worker, you should self-quarantine. There are like things within the DHS guidelines where, once the disease becomes widespread enough, then they're encouraging health workers, if necessary, to continue to come to work. But if Mox said that they were doing fine as far as medical staffing goes, then they should not need to have people who were exposed going in. So we tried to raise hell about this basically, and then a few days later, I got a call from Bill, and so I've edited that call to just 5 minutes of audio so that we can have his voice here with us today. So we cover a couple different subjects, but it's mostly about, it starts with me asking him how it was that whether or not they acknowledged any of the alarms that we were trying to raise or the pressure we were trying to put on.
Statement for phone conference. Intro. My name is Damani Natambu. I'm 53 years old. I'm from Washington, D.C. I'm a federal prisoner.
Let me try again. Give me just one moment. Gotta move this. One moment, please. Technical difficulties. Pulling the file. We can get it in a different program.
The likelihood is that if they are, they're not going to acknowledge it.
Let me just confirm here. Can people hear? Thumbs up if you can hear. Or nod your head. Okay, great. Got a few.
They like to keep things on the down low.
Right.
But they also don't want to acknowledge that we're having any effect on anything But, you know, the same nurse that I was talking to, she's still down here handing out medication this morning.
Wow.
We got staff, like I said, it's that same sergeant, she was on the other night again. But no self-isolation. And she's saying that the DOC is refusing to let these people self-isolate, that they got to come to work. The implication being that, like I said before, the implication being that if they don't, they'll get fired.
Right.
Or they're short-staffed on nursing. The turnover on nursing here is ridiculous. People just, they come here and say, no, I don't want to work here under these conditions.
Right.
You know, because security actually runs HSU here.
Mm-hmm.
You know, for all intents and purposes. So, you know, the problem is here is that they use nursing agencies, right? And so these people say, no, they have the choice of, you know, I just don't want to work
All
here.
calls other than properly placed attorney calls may be monitored and recorded.
But they've always been short nursing, and now they refuse to hire it. They got a freeze on any hiring too. You know, it's like this morning I heard it again from the nurses that, oh, we're so short-staffed and we're overworked, and the thing is they're not qualified or capable for COVID-19 care either. So, and the last resort and I mean the last resort will be getting us to the hospital.
Right.
And, you know, I have a serious issue, and I was scheduled for a procedure. I can't get a procedure because they've canceled all HSU, or I mean hospital visits too. The thing is that there's a serious disconnect between the administration and the line people too.
Mm.
And then there's the usual problems like, you know, like I had to, you know, one guard he was lying about guys, and then I had to write him up for some actions he was taking, and you know, there's some really shady people here too. So, I mean, which makes it kind of bad for the ones who are good people. You know, there's actually some really good guards here, but boy, some of the other ones are just unreal. I mean, that's always been the problem, you know, but they've like in segregation, they've had guys quarantined up there, and then also in the R&O, I don't know if anybody was quarantined there, but the guys in segregation here at CCI, I mean, they cut themselves constantly.
Right. Yeah.
Because, you know, conditions and stuff, you know, are so stark and everything, but
Yeah.
When certain people talk to me, like up at HSU, and they say, yeah, we got people that are isolated and quarantined and some guards out. Well, that's the thing is they don't test anybody that I know of here or down here. I mean, we're locked in most of the time too. I'm one of the few that get out for HSU and stuff, but I just got a letter from a contact in Tachita, and she says that they still got the the prisoners working, and while they're working, they do the separation, and then they let them out.
1 minute remaining.
Then they let them out to eat, and they're sitting right on top of each other, you know, crammed in 6 to a table. You know, so I don't know what's going on there either. And I guess they're still getting some kind of day room too, so it's inconsistent, and I don't know what the hell's going on with that, because that just shouldn't be happening. So.
All right. So yeah, Bill Ledford is he's an experienced prisoner litigator. He's been a long contact with FFUP. He was sentenced under the old law. He's got diabetes, and because of medical neglect, it was so severe that he lost both of his feet. And so he has to get these bandages wrapped regularly. He sued the DOC over that, and many other issues. Yeah. And so that is what we have as far as our featured speakers go. Ty, what do you think the best way is to try to open up the questions? Should unmute everybody?
Nope. I think we can first give people a chance to do it themselves. We'll just go like one at a time and call on people.
Okay.
And then if you want to ask a question, feel free to unmute yourself. And then if we'll give a second chance to people who are on phone devices, not videoing or calling in on the call, just with just a phone, we'll give them a second chance in case they are unable to unmute themselves on their end. So I'll control the names here. First up, I have Ron here. If you have a question, feel free to unmute yourself. All right, let's move along to, it looks like my list popped up. So Stephen, you somehow made it up the list. If you have something you would like to share at this time, feel free.
No, I'm good.
Great. All right, Andrew, I don't have a last name. Feel free to ask a question if you have one.
Question.
Oh, sorry, can you repeat?
Okay.
Okay.
It looks like Tim, maybe you had a question?
Can you hear me okay?
Yep.
Going back to the very beginning of the meeting when I signed in, first of all, not looking at the site but once a week, I sort of forget how to use the microphone. But you're talking about the PD, the public defender, and so on. And since I live in Tennessee, I'm not in Wisconsin, but you were talking about inmates, I mean, if they're going to be reviewed again, or if the public defender is going to be involved, it goes back to the original county where the offense originally took place. What happens, I mean, if a inmate has been in the system for a long time, COVID-19 or otherwise in today's standards, but if they've been in the system a long time, they've been transferred from one facility to another during their stay, the original offense, if it was done in an area where they're, I hate to bring this up, but like prejudice or whatever that it might be, it seems sort of ludicrous to think that a change of venue couldn't be done. Because if it goes back to the original county, and there's a public defender that is in basically also under the same jurisdiction as a judge, that you're sort of darned if you do and darned if you don't. An inmate, whether it's old law or the old rulings or not, doesn't seem like they're going to have a fair chance. Is there any way to get around that?
There might be a way to do a change of venue. I think that would depend. I would have to ask the public defender. So the place to start is contacting the public defender office in the county where someone was sentenced, not where they're currently incarcerated, but where their sentence occurred, because it is the judge or that court. If it's not the exact judge that sends you, somebody else from that same district has first jurisdiction on it, and the public defenders might be able to do a change of venue, but it's my understanding that you have to at least start there, and hopefully in that county there will be a public defender, and if the public defender I guess I can say this. I'm getting this information from Jennifer Bias, who is the head of the trial division at the state public defender's office. She might be more aggressive and willing to fight on things than all of the people who work for her. So there might be some public defenders in some counties, like you're saying, who don't, where you don't have as good of a chance because of the judges or because that public defender's office is over tapped and doesn't have the capacity to take things on. In which case you can try contacting the public defender, like the Madison office of the public defender, basically. And so that, and see whether or not there's other options. Jennifer in my conversations with her, it seems like she's very determined to try and get something done about releases. And she's very straightforward in talking to me. So if there's any chance on things, I would encourage people to try calling her. Her information is in the public defender on their website, in their staff directory. Also, the email that I'm going to send out has contact info for each county as far as I could find it. And then also at the bottom for the counties that I couldn't find is the number for the central admin of the public defender. So if the county that your loved one is sentenced in isn't on the list that I was able to put together, that means that a different county's office is serving that county, and I don't know which one. But if you call that central number, they should be able to tell you.
I'm sorry, what was Jennifer's last name, Ben?
Bias. Kind of a funny name for a lawyer to have, but yeah, B-I-A-S.
Could I jump in here? Can you hear me?
Yep.
Do you also have a list of judges who are, we were talking about it, judges who are more disposed?
I do not. I know that the chief judge here in Milwaukee, Mary Trigiano, Trigiano, has talked to the media and seems to be active in trying to do something about COVID-19. But mostly as far as people who are pre-trial or something like that. So we're optimistic that in Milwaukee, the people who are sentenced in Milwaukee will have some kind of a shot at this. I don't know about other counties, and yeah, I don't have a list of all the different judges. Jennifer did say that there are some counties like Rock County, or what was the other one? Waukesha, Ozaki, Walworth, those are all of the notoriously conservative areas and harder to get anything through. But she's had some openness from some judges even in those places. And then other places like La Crosse, she seemed pretty optimistic about because there are not all that many cases there, and so the judges might have more time on their docket space to try to do something about it. So it's kind of hard to predict at this point, and once the process moves forward, we will hopefully get more information about what works best where.
Okay, Gerard and Linda, you guys are up next. Questions?
No questions.
Or updates?
Thank you.
No updates. Can you hear me?
Yep. Oh. Yep.
Okay.
Okay. Moving on. We've got Julie. If you have questions now, I'm going to unmute you.
Yes. This is Julie. My son is Ken. His number is 470-618. He's an OSCI. Well, what I'm wondering too now is who's the public defender for Price County? Does anybody know? And then somebody mentioned something about a general number for a public defender. Can they give you that? Can they give us that over the phone?
Yeah, so I have those numbers. It's on my other computer. I'll look it up while the next person's, well, hold on just one second. Let me look it up.
Okay.
All right. While Ben is doing that, here we will move on. I'm going to pull up Jody here.
Peggy?
If you have questions. Okay.
Peggy? This is Julie again yet. I was wondering also if you sent any of the recent stuff to Ken again lately, like the waiver form. He managed to misplace one of them that he had, so
Yes.
hopefully we can get another one.
Yep. Waiver and something else. I think I sent him the HIPAA form. I'm not sure. I sent him a packet.
Oh, okay. I'll know what it is and find out most likely Wednesday night then, because he calls.
Okay.
So thank you.
All right, so Julie, I've got a phone number here for you. There is not.
Yes, sir. Go ahead.
there's not an office specifically for Price County, or was it Price or Pierce?
Okay, so what's the number?
You need to go slower.
Okay. The number for this is for the admin of the trial division.
What's it for?
This is the number for the admin of the trial division of the state public defender.
Okay.
The number is 608
608.
267.
To what? To what?
267.
Oh, 267, okay.
9588.
9588. Okay, and that's for what again?
That's for the statewide trial division administrator.
Okay, thank you.
Yep, and they'll be able to tell you who to contact for your county.
Okay, thank you so much.
Yep.
Okay, super. I'm gonna go ahead and mute you again, Julie, and then we're gonna go to Jody next. Give you a chance here.
Yeah, it's not really a question. I was going to let you know that I got a hold of the public defender here, and she kind of was wishy-washy, and she told me she had to contact somebody in Madison, and that I'm supposed to get back to her after Memorial Day. And she also suggested, she told me that my son's judge will be retiring in August, and that may be the best time to bring this forward in front of a different judge.
August.
So that's good news. What county is that?
He was sentenced in Chippewa County, but it's the Eau Claire County public defenders that take it.
Okay. Yeah, so if you or anybody else, if you follow up, tell them that Jennifer Bias is the person who said that that you can get that asked us to contact people. And so she's like the boss of the boss. And so it's on her authority that we're doing this, and so hopefully that will help the wishy-washy public defenders actually move to take action.
Okay, thank you.
Yeah.
Okay, great. We are going to move on here to Lucas. If you have any questions or want to share anything with us.
Can you hear me?
Yep.
Cool. Yeah, hi everyone. I'm Lucas Dici with Save the Kids in Superior, and it's really great that you're having this. I've been kind of writing for like social resurgence online. Hold on for a second. Online about this. Kind of like this week is the National Week Against Incarcerating Youth and everything. And I know someone in Racine that actually has someone in CCI, and it's really good to like try to organize this and try to connect with people in Superior.
Cool. Thank you for calling. We're having some problems with your video.
That's okay. We can hear your audio. So I'm just gonna move it away. Lucas, just want to make sure, in case you are having connectivity issues, that if you wanted to add anything else. All right. I will feel free to raise your hand or use any other features in the app to communicate with us if you wanted to add anything else later on. Okay, moving on here, we are going to pull up Michaela. So feel free to unmute yourself.
Yeah, I don't have any questions. I just wanted to add that I contacted the public defender's office in West Bend, and they really, I talked to one of the public defenders, and he really didn't have any knowledge of this whole process. And but I'm supposed to hear a call back from the regional manager.
Okay, yeah, we are exploring things. I think it's going to be pretty uneven office by office.
Yeah.
Thank you for doing that and reporting back. And hopefully, if we continue to have problems in any county, we can follow up with Jennifer and see if we can get something that's more responsive or better understanding what's going on.
Would Jennifer be, can you hear me? Would Jennifer be willing to write a letter, to write a cover letter that people could use? Just saying,
That's a
I
good
think
idea. I will ask.
that everybody could use. What do you think of that?
I think that's a great idea. I will ask her. I'll give her a call and just follow up on all this and ask her that question.
She would give guidelines of what the criteria would be. She could do a lot.
Uh-huh.
Okay. And moving on, we have Ricky here. Feel free to unmute yourself if you have questions or updates you want to share. Turn it off. Turn off the video. So either Ricky have nothing or are having connectivity issues. So I will give you a bounce back. All right. I know you were in before. I think this may be Beatrice.
This is Beatrice.
All right, perfect. Did you have any questions?
Yes, this is her. No, just I'll add to the one recording we listened to at CCI. Yes, my son is at CCI, and also he had told us also some of his pictures that his children drew were thrown out also in some of his things when they went through their cells. So that didn't just happen. Was it William that spoke of that?
No, that was Damani, but yeah, that.
Oh, yep, same thing for my son there. And about the medical neglect, that's very true. Also, I had to actually have my son get me on the list, so now I'm actually able to contact the medical team if need be. So those things are true, by him also. And then I was wondering, Peg, did you mail out all the waivers? How many packets did you mail out to the governor? 3 so far?
No, 2. The third we're in the process of. 75.
So that's probably
yeah, 75
okay.
so far.
Okay. Yes, I don't know if my son's probably didn't go out yet. Okay.
What's his name?
Marcus. His is for maybe modification, you guys had told me.
Marcus what?
Pat Nod.
No, I think he's in this next one.
Yep, that's what I think too. Okay, and then I am going to contact the public defender to see about his modification also and make sure he's getting into the program need because he's supposed to be out less than a year. So,
Cool.
And then that phone number, that hotline number is for prisoners, right? To call?
Yeah.
Mm-hmm. But you're welcome. I mean, family members who have reports or have spoken with their loved ones or anyone from the outside who also wants to report on behalf of that prisoner, so the prisoner doesn't have to. You can feel free to call that number as well, or share that with others who may feel need to go through that route to share their reporting. We certainly don't want to make anyone feel like they're putting their own safety at risk to do this.
Right. That's why I was wondering if we can report for them too.
Yep.
Okay,
yeah, absolutely.
Perfect.
Yeah. So we have it works 2 different ways. So the prisoner can call us collect through the prison phone system, and that we have that. We're accepting and using donations to fund that hotline. We are looking for other funders as well to continue funding that as more prisoners begin to call in. I just wanted to mention that Jody and Mary Gerson have graciously volunteered and stepped up to take some of the first couple of calls so far. So we are live and reporting those results. Recording those results now. So yeah, thank you both for doing that, and feel free to contact me if you want to get added to that call chain. But yeah, so prisoners can call collect, and then yeah, if you have if you call us as well, that'll be free on both ends. So yeah, there should be no monetary barrier to getting these reports in.
All right. Thank you so much for everything, you guys.
Could I say something
I'm
real
good.
quick?
Sure.
Yeah. If you call for a loved one, just make sure you get as much information as you can from them, like what unit they're in and names of people that know of the situation, so we can document that when you call.
Okay.
And we'd be happy to share. We have a kind of a paper form that just really rudimentary form that we created that we can share with you if you wanted to print that out or something like that, and use that to record the conversation or the information for yourself. It's certainly not always totally comprehensive or anything, and I'm sure we've probably left some key detail out, but at least it gets us somewhere. And yeah, just one thing to Mary and Jody, since we have you both on the line. If you are not able to accept a call at that time and speak with somebody, just be sure to let the call ring through. So mute your phone or whatever you need to do to not accept the call, but try not to decline the call. That'll cut off whatever opportunity another person has to accept the call if they are available. So yeah, great.
Ben and Peg, I have another question.
Mm-hmm.
Okay.
With the situation with CCI, do they have an outsourced or other team still in there investigating all of that right now, since it is, at a bad stage right now?
I do not know. So yeah, I know that Damani's audio was hard to hear, so maybe I'll just quick summarize some of the things he was saying. The warden at CCI has been replaced.
Yes. She has been, yes.
A lot of her security people. Larry Fuchs has come in to replace her as the new warden there, or the acting warden, I'm not sure. And he brought in the security teams that did a full sweep of the institution. It seems like that was mostly motivated by the escape that happened early April. But yeah, they went through the entire institution, took all kinds of people's property, and have it was really, really brutal and unnecessary, especially since the two guys who escaped were helped by staff. They are Zamani says that they are affiliated with white supremacist organizations, and so for his cell, particularly to be fair, he's a black nationalist. He had a bunch of newspapers of radical black politics that were taken from him because a couple of guys with radical extremist white politics managed to escape. Is par for the course in Wisconsin's racist prison system. Okay. Yeah, as far as I know, there's not anything going on. The lockdown is continuing, but the security sweeps and things like that have stopped at the moment, but they can always, pull that as a surprise at any time.
Right. Now I have a question. If any of you would be in a prison visiting your loved one and you saw the guards in the visiting area falling asleep, who would you report that to? It's on camera.
Peggy, do you have any suggestions for that?
Thank God. Sleep more. Give them sleeping pills.
But seriously, I've been in there a couple times and the guards are sleeping.
Yeah.
At the counter,
and
eating
did
their
you
lunch.
ever notice the weights? The weight difference.
Yeah, that weight too. Yeah.
I I don't know. There's some really, especially in visiting rooms, they tend to have the more mild-mannered guards.
Yeah, they do. You're absolutely right.
And in the, yeah, I don't, you know, I have nothing to say. That's just nothing.
No.
I mean, we also know there was some reporting in the Journal Sentinel about a guard who was getting, like he ended up earning $160,000 a year or something like that because he was doing so much overtime. And he was working an average of 90 hours a week, I think. I'm bad at remembering numbers, but it was something absurd like that. And if you're working that many hours, you're definitely sleeping on the job.
Oh yeah, just like there's a limit of how much you can drive over the road. You know, hey, any job should have that.
Right. Yeah, but with the DOC, there's so few people who want to work in these places that they've just opened up that level of overtime for people. And there are guards who
much of the overtime, it used to be mandatory also. I mean, they had people going 2-3 shifts. Yeah, I didn't think of that. Right.
That's
right.
crazy.
I didn't think of that. Yeah. That's.
Well, obviously it's on camera, so if I report it ever anonymously, they can look on the camera and find out. So.
Yeah, I mean, the judge or the warden or the security director is the person to take any kind of complaints that you have to.
Okay.
We do have some new information that I've heard, but I haven't been able to confirm about the complaint situation. I got an email from somebody inside who said that the Division of Internal Affairs is active now. This is something that Mosca told me about a long time ago, and we're hoping that it improves the complaint situation. It is very common in the DOC that if you complain about somebody, your complaint just goes to somebody who's friends with the person who you're complaining about and doesn't get beyond that. Unfortunately, it sounds like the head of the new Division of Internal Affairs is, her name is Christine Preston, and she used to be the head of the PREA office. PREA is the Prison Rape Elimination Act. And we know that the DOC has not been good on PREA issues. And so for her to be the head of the Division of Adult Institutions the head of the Internal Affairs division does not inspire a whole lot of confidence.
Okay.
Yeah, I have dealt with her on PREA issues, and absolutely, she's not gone. No response at all. I mean.
Well, thanks for everything you guys do.
Yeah, I mean, we would like to see what Peg has been talking about for years is the recreation of an ombudsman, which is somebody who works for the governor, doesn't work for the DOC, is more independent, and is
I agree.
Oversight.
I agree. I told my husband when my son gets out of prison, I'm gonna seek to have some kind of movement or some kind get through the, like I said, the legislative, and help get someone hired that, like you said, is neutral, that goes around and finds these flaws and they correct them.
Right.
That would be outstanding.
Well, we need a governor who is more truly committed to reform.
Well, right. We got to wait for that to happen.
Yeah.
No, we make
I don't think he'll get,
All right. We want to move on. Is there anybody else who has questions?
Mary, you are the last person here that has not been given an express chance.
Yes.
Did you have anything that you wanted to share? Updates? Or questions?
I'm Mary.
Hi, Mary.
Yes. I was just wondering now, with we had a sheet printed out from the prison, and I've got 6 copies of them, and it also says in there that he is supposed to be out already, and he isn't. I've mailed them to several people, the governor and all that, and He was supposed to be out 2 years ago, and he still isn't out, and he's in very bad health. Now, I think he should be out of there, and he should be someplace where they can take care of him and send him to the right doctors and stuff, because Monday morning or Monday night, he almost passed away because of that, because of their neglect. So what can happen there?
I think it sounds like you're advocating in the directions that need to be advocated in.
Yes.
Is he on the old law or the truth and sentencing?
Is he on what?
Is he sentenced before 1999? No, he was. I think I remember.
He was born in 55, I think.
Yeah, Peg, do you have any suggestions for other things?
Yeah, I just scanned his waiver and I didn't see that. I don't know that I have that information. I'll have to talk to you, Mary. I didn't see the information. That he's beyond. Truth and sentencing, I don't see how they can keep them longer. We'll have to investigate.
Okay, would you please? Thank you.
Well, we'll talk. I do have something, if I could,
go ahead.
lab some more. A lot of my work, since it's very hard to deal with something as corrupt as this and get anywhere, but where the success has always been dealing with individual inmates. And I get very close with letters and trying to help particularly solitary prisoners maintain themselves, getting things in. It has become harder and harder to get materials in there. And I just got a letter that now they're requiring everything coming in has to come by UPS, which eliminates a lot more of the books. Right now there are just 2, even the free books can't get in. I'm wondering if they're, email me if anybody, I think this is a big deal, particularly in the solitary, in the COVID with everybody locked down, to get materials in there that help them maintain themselves. Somebody that would like to strategize with me on this. You know, I go to Magda and it just doesn't. The simplest thing of allowing email receipts and not paper receipts. No internet will do that, you know.
Well, can't he be released as bad as shape he's in? I mean, can't he be released to come home by me? I'm alone now.
Yeah, I'm talking to someone else, but yeah, we will talk about that, Mary. Anyway, my message is through. If
okay.
Yeah.
Okay. Thank you. I'll wait for your call.
Okay. Yeah, we are trying to get everybody who's in that kind of situation released. The clemency campaign is the governor is the person who has the most power to do it, and so we really want to see that happen.
Yes.
Is there anybody else on the call who has any questions or other information to try to share? All right.
Ben, this is Jody. You had said earlier something about if they're not on a list. The public defender told me that she didn't see my son's name on the list, even though he's up for ERP in March. And then you faded out, and I couldn't get the rest of it of who we should contact about getting the list. Was that Jennifer?
So yeah, I'm not clear on the ERP list and the list that the DOC, my understanding from talking to Jennifer is that they reached out to the DOC, asked the DOC for the list. It took the DOC like 3 weeks to get back to them with a list of people that they could reach out to. Then they reached out to those people. And I think that might be where, like, we saw that memo from Makta about how you have to be 60 to 65, et cetera, et cetera.
Yes.
I think that might have been how they made that list up. But that is not a requirement for the judges. It's not a requirement for the public defender. Seems to be that's something the DOC made to try to filter people out. And so, yeah, continuing to contact the public defender's office. If you call that number that I read off earlier, that is basically, I think that is Jennifer Bias' secretary. And so you can ask them any questions and follow up. And if you say Jennifer Bias, you know, if you ask whoever is unclear about what's going on inside the public defender's office, ask them to talk to Jennifer Bias. She can help clarify and get them on the right path.
And what was that number again?
Yep, it's 608-267-9588.
Okay, thank you.
Yeah, it's the administrator for the trial division, and Jennifer Bias is the head of the trial division.
Okay.
All
Thank
right.
you.
Thank you. All right, I think that's all we have for this week. Thank you all for joining us again.